Hey, everybody. Welcome back to Healthcare Consumerism Radio. This is Brent Macy, Managing Director of the Institute for Healthcare Consumerism, along with CEO and founder of the Institute for Healthcare Consumerism, Doug Field. And jumping into our next segment here, we have Dr. Jaime Estupiñán. He's with Strategy and Jaime, are you on the line with us?
Yes. Hi, good morning.
Good morning, Doctor. Kind of give us, and welcome to the program, kind of give us a quick background on Strategy and we'll get a little more into, some of the key findings of a survey you guys recently did.
Yeah, absolutely. So we're Strategy and, formerly known as Booz and Company. Mm-hmm. We're part of the PwC network of firms, and we are essentially a general management consultancy focused on strategy from a variety of areas. In particular, we do a lot of work in the healthcare space, mm-hmm. and over the last 2 decades and over the last few years, I've spent a lot of time thinking about consumerism in healthcare. And as part of the PwC network of firms, we bring a lot of offers, work with a lot of health services clients, hospital systems, health insurers, also with pharmaceuticals, medical device companies, and bringing a whole range of offers. In particular, we have done a lot of work on consumer-centric capabilities. In fact, have been ranked very recently as the firm out there with the deepest capabilities in terms of helping health services clients create experiences and impact consumer fields. So.
Yeah, congratulations, Jaime. This is Doug Field. Welcome. Good to have you here. Talk a little bit about. You've recently completed an extensive survey of over 2,300 U.S. consumers. Talk to us about some of those key findings.
Yeah, absolutely. So we've done this research, and again, it's always trying to stay abreast of what how people are thinking and how they're picking up their engagement with the healthcare system. And in particular, this year, we wanted to make sure we captured how people are experiencing things like the health insurance exchanges, but obviously the public exchanges out there, but also some of the increasingly common private exchanges where some employers are allowing folks to buy insurance. So we've done this research. I think some key findings, right? For the most part, consumers out there, they don't feel very satisfied with the experience they have as they engage with the healthcare system, as they think about their coverage and their treatment. When we talk about specific elements of their experience, there's pockets of satisfaction. So another interesting finding is that, in fact, folks who have been signing up through the exchanges, for the most part, are satisfied. They feel some empowerment. They're happy with what they're getting in terms of being able to get insurance. We're finding folks. Another big finding has been that we test to what extent people would trust non-traditional healthcare companies with some of the things that they get from healthcare companies, like insurance or care. So we asked them, for example, how willing would you be to let a large technology company like a Google or an Amazon, or a large retailer like Walmart or Target. And interestingly enough, folks, for the most part, are very. They will go with those companies. They have absolutely very little preference for their traditional healthcare providers. So that's another interesting aspect of this, and especially with a lot of these other companies trying to enter the marketplace. There's a willing and accepting consumer out there that, for the most part, has not had their needs met, and therefore are willing to try new players.
Is it also, Jaime, because those are brands, consumer brands that they're comfortable with and they're familiar with, versus a lot of individuals aren't comfortable, to your point about the health plan provider? It's been a relationship that really hasn't been that consumer friendly, whereas a Walmart or or an Amazon or a Microsoft or a Google has been more embracing to the consumer.
Yeah, absolutely. So there's definitely that. There's a narrow relationship with some of these brands, and associations are different. But yeah, it's a variety of factors. I think as we even ask specifically what aspects of what they get out of the healthcare system today, like, their benefits, their ability to, be guided to care, the actual care, all of that. It's independent of any of that. So folks, yes, they do have a willingness to try these new players, and to your point, they do in many cases have a much favorable association with some of the brands that are out there.
I mean, what's the awareness from your findings, or did you find around the emerging transparency solutions? And we know we're in the early first phases of transparency kind of coming to fruition. There's a lot of things that have to change. But what's the consumer's awareness and embracing even or pushback to these transparency solutions?
Yeah, I would say as we have tested some elements of value propositions out there, and transparency is one of them. I would say that folks are increasingly embracing that. I would not say that there is widespread awareness. It is not necessarily one of those things that people ask for. Absent, I mean, people talk about, hey, the healthcare system is hard to navigate. It is complicated. But specifically, transparency is, hey, they're not necessarily asking for those specifics. They do sometimes want to understand, okay, what does it really mean for me? So it's one of those things that as people start understanding, then suddenly it does, they find that it meets a need, and they start getting more and more acceptance. But increasingly, we're seeing that, so it's almost becoming table stakes out there in terms of making sure that those tools are available when people are, especially when they're dealing with insurance. Yeah,
because we're still at the early stage. Wouldn't you agree, through your findings, that the consumers don't necessarily know what to ask for?
Yeah, absolutely. I think our general theme is that there's a lot of value to be achieved in terms of reducing the cost of healthcare and improving its quality. And there's different levels of value from a more transparent marketplace, right, which is part of the point of healthcare reform and the exchanges. There's value from reducing waste and overutilization, and essentially going to the settings of care that are more costly than alternatives. And then there's a lot of value associated with just people making the right choices around their own adherence, their own diet, their own exercise, and just how they take care of themselves. The sense is and I think PwC and others have put estimates out there of how much value is out there if we really were to achieve all of these things. And our sense is that it's we're still very early on. It's very we haven't really tapped into all of the possibilities that exist by better enabling folks. What we do, obviously, what we are seeing is that a lot of people are increasingly bearing the weight of their choices, right, either through having to select products on exchanges or increasing prevalence of consumer-directed health plans. So it's definitely increasing out there, but the ability to really manage those choices for improvement, I think our sense is that there's still a lot to be achieved, and part of it is this idea that I still don't really trust a lot of the stakeholders that I interact with across the healthcare system. So for the typical consumer, there's still a lot of things that need to be overcome for really to some of this value partnership to start to realize itself.
Doctor, we always at the Institute here talk about how disruptive this market is right now. Disruptive in a kind of in a good way. It's just there's a lot of change that's taking place, and you alluded to some of these changes that in your findings. But if you look at some of the traditional providers out there that all of us in this industry may be familiar with, and the consumers, they may be familiar with them as well, what do they need to do in order to remain competitive with all these non-traditional players coming into the market and trying to compete as well?
Yeah, so there's a few things that we say that people need to focus on. So one is there is an element of, okay, just how you think about the consumer, making sure that there's some vision, some alignment around, okay, what does the consumer represent for us? You know, how do we create value, and how do we create value for ourselves and the consumer? So just understanding what that is, right, and who is it that you serve. There's an element of really focusing on your experience. So, you know, most stakeholders in the healthcare system are very, you know, most folks do this because there is this, you know, strong calling. But translating that into, you know, the right experience from the perspective of the individual or the member or the, you know, patient does take some special sensitivity. And I think, you know, some of this is, you know, borrowing from other industries, really investing in the capabilities to, you know, provide better service, understand your consumer, to really engage them right through digital channels and other places. So the experience is an important part. The pace of innovation needs to, you know, essentially, to your point, a lot of these stakeholders, traditional players, you're competing with, in many cases, companies that have a different level of agility, a different culture, in many cases very well funded, increasingly faster with technology. So a lot of these players, they do need to step it up in terms of their agility and the way in which they innovate. And in fact, we're seeing a lot of players saying, you know what, we actually need to start creating some of these, you know, self-disruptive models, you know, within our company, and we're trying to build this in a way that is unencumbered by, you know, legacy systems, legacy processes, and let's see if we can create some of that. So that's another important element. And the last and important one that folks should not lose sight of is this idea that all of this, right, the system out there is changing, and you do need to focus on doing the things that will be needed in the future as opposed to the things that you've been doing all, you know, getting to this point. But as you're doing that, increasingly just a key way to be competitive is how people manage their cost structure. So a lot of consumer centricity when we think about exchanges and when we think about, you know, provider systems is around providing the right experience and in many cases making sure that it's as efficient and as lean as possible. So the idea of focusing on what you do, what will be needed in the future, and trying to be as efficient and as lean as possible on all the other things that you still need to do but are not necessarily going to, you know, create the differentiated value for the consumer. That's something that incumbents really need to be focusing on, because that's essentially the currency that allows them to compete and allows them to, you know, make the investments required to better serve the consumer. So.
All right, Doctor. Well, we really appreciate you joining us on the program today. Let our audience, where can they find this survey if they'd like to get a hold of it?
Yeah, they can reach out to our website. So it's www.strategyand.pwc.com. So that's where a lot of our thought leadership can be found.
All right. Thank you so much for joining us on the program today. Have a great weekend. And to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.